The most popular procedures that we offer at Blue Line are one, veneers. I think veneers are a fantastic product in order to change your smile, to change your look, to fix chipped teeth, misalignment, to revitalize those teeth to when you were 20 again. That is a huge and really popular option at Blue Line Dental, and it's something that we love to provide for our patients because it really does change how you look, how you feel. Another super important one that we tend to do quite a bit is a whitening, something simple. If people aren't ready to go through a process like veneers, but they want some temporary color changes, a whitening is a really good and non-invasive way to do that. Granted, you can't get the huge dramatic change from chipped teeth, misaligned teeth, but a brighter smile always, that makes people happy, and it makes me happy too. I love seeing white teeth. Those are, I would say, two of our biggest, most popular options for cosmetic treatment. Veneers are super cool because veneers are very thin layered porcelain kind of shells that go just in the front of your teeth. We love to do them because they really do change a person's smile. That's what we're looking at. If a patient comes to me and say, I'm not happy with the way they look, then a veneer is a really good option because it's conservative. You are not removing a lot of tooth structure, and you are reconstructing the mouth, making the smile broader, making it wider. But the way that we do it at Blue Line Dental is you come in as a patient, we scan your teeth and take a full set of photos. From those photos, I can then start designing your case with a ceramist at a lab, trying to determine where I want your teeth, what improvements can happen. And then we bring you back into the office for the preparation day where you'll actually prepare the teeth. I'll show them to you before we even start working so you get a good understanding. We prepare the teeth, take an impression, and send it out to a lab. There I work with the ceramist who hand paints and hand layers that porcelain onto your teeth. So when you come back in a few weeks, now you have the final product and they are exactly what you're looking for. The benefits of choosing veneers or their other cosmetic options is how long they last and how beautiful they look throughout that time. You can choose other cosmetic options, like for example, a bonding, and that can be beneficial in certain cases. But the beauty of veneers is that they will retain that beauty over a long time. Composite bondings, they tend to lose that shine and that sheen, and they need to be repolished or redone after a few years. But veneers can last 15, 20 years and give you that same beautiful outcome throughout that time. That's why veneers are, I would say, the number one choice if you really are trying to revitalize your smile, to change something so important to you, which is your smile. Veneers, I think, is definitely the option. Whitening is super cool. I love the product that we use for whitening. It's called Pola. I've worked with Pola for quite a few years. I've actually done a lot of whitening for the Miss USA pageant winners and Miss Universe? For Miss Universe. And the way whitening works is I fabricate you a tray that you take home and you use that for 2 weeks at home. And that starts to get your teeth ready for when you're going to come back into the office and do an hour in the chair, where we do a chair-side whitening. Doing the combination of both the take-home and also the chair-side whitening, I will get a lot of great results. That's what I can guarantee will show you some really dramatic changes in your smile by putting a little bit of homework in and then coming into our office and doing an hour in the chair. We do have other options where you can, if we're New Yorkers, so we're running limited on time, where you can just do an hour in the chair 1 week and then maybe come back in another 2 weeks and do another hour in the chair. Both are very good options, and it depends on how it fits into your lifestyle, but that's something we discuss with patients and find out what is best for them and how we can get their teeth from where they're at one appointment to the wider option that they're looking for. That's our whitening option. I think one of the most common misconceptions about cosmetic dentistry is that it is purely from a appearance standpoint, right? Are we just changing how we look, just to change how we look? I think cosmetic dentistry is so much more than that. When we treat teeth for veneers or if it's crowns, depending on what the case requires, we are not just improving the aesthetic look of it, we're also improving how your teeth come together, right? So we move these teeth using porcelain from the position they're at now to something more ideal that would be more balanced over years to come. Because if we're about to place veneers in your mouth, I want to make sure that they are going to be there for 15, 20 plus years. So that's one misconception. The other misconception is on the I would say, the other misconception would be on the cosmetic aspect of it. I think it's important. I think cosmetics are important. Cosmetic dentistry really changes how you feel, and that matters. I think when you're walking down the street and whether you smile to that person that's walking past you or you don't smile because you aren't happy with how your teeth look, that affects you long term. I think it's important to be able to go into work and be able to laugh as big as you want, or to be at a party and smile for those pictures. That is super important. And if we can help you get to the smile you want, to help you get you to feel better about that smile, I think that that's super valuable. And cosmetic dentistry can do that. It can change your outlook for years to come. And that's why I love doing cosmetic dentistry.